there, my name is Kylie Street and I will be presenting my medical conditions project. I will first off by talking about pneumonia. The word pneumonia means diseased state of lung. There's a word root and a suffix. And for this definition that was from our textbook, it discusses basically that pneumonia is an infection or of inflammation caused by, there's different types of bacteria that causes this disease state of lung. Anatomy affected by pneumonia. It affects the lungs, which is a part of the respiratory system. This disease can affect one or both lungs. Pneumonia affects the air sacs in the lungs, in which the air sacs may fill with fluid or pus. The filling of the air sacs causes a cough containing pus or phlegm. Pneumonia is suspected in patients who show fever, cough, chest pain, shortness of breath, fever, chills, and the patient will cough up mucus or phlegm. Pathology of pneumonia. Pneumonia is caused by the inhalation of a bacteria, fungus, or viral infection. It is inhaled into the alveoli of the lungs. Once the offending agent is in the alveoli, for example, bacteria, the bacteria will travel into the sacs or into the spaces on the cells and in between the alveoli. This type of invasion causes the immune system to send neutrophils to kill the offending organisms. The role of neutrophils releases cytokines, which causes the symptoms in a patient to have fever, chills, and fatigue. Diagnosing pneumonia. A physician will conduct a physical exam. The physician will listen to lungs with a stethoscope. Pneumonia particularly will make the lungs sound like there is crackling. So a physician will hear that crackling sound in the stethoscope. A physician may conduct chest x-rays if they suspect there's pneumonia. They may test the sputum to examine the mucus or phlegm that patients are coughing up. And a procedure that may be conducted is a bronchoscopy. And this is done if a patient is hospitalized and antibiotics are not working. So this procedure actually looks into the lungs airway. So some treatments. Fluids will be asked for the patient in order to break up the phlegm. The patient will need to rest. The patient will need to take NSAIDs for fever. And antibiotics will be needed to take in only if there's a bacterial infection. Severe pneumonia, this will be treated in the hospital with an IV of fluids, oxygen therapy, and breathing treatments. Some different medical specialists, these kind of depend on the age of the patient, but an anesthesiologist, a geriatric medicine specialist, infectious disease specialist, a neonatologist, pulmonologist, and respiratory therapist. Next, I'll be talking about prostatitis. Prostatitis is an inflammation of the prostate gland. This word has a word root and its suffix. A definition is from the Mayo Clinic is prostatitis is swelling and inflammation of the prostate gland. A walnut-sized gland situated directly below the bladder in men. The prostate gland produces fluid, semen, that nourishes and transports sperm. Anatomy that's affected by prostatitis. It affects male's prostate gland, which is located below the bladder, and you can see that below in the diagram there. Prostatitis can affect men of all ages, but is seen more commonly in men that are 50 years or older. Pathology of prostatitis. The cause of prostatitis isn't always identified, but it can be caused by a bacterial infection. So according to some researchers and authors here in this particular article, they noted the presence of acute inflammatory cells in the glandular epithelium and lumens of the prostate with chronic inflammatory cells in the periglandular tissue characterizes prostatitis. So various routes have been postulated, but pathology is still unsubstantiated. So diagnosing prostatitis. A physician will obtain a medical history and a physical exam, which may include a rectal examination. There could be some diagnostic tests, such as urine tests for infection, a blood test to look at infection and other prostate problems, a post-prostate massage to test the secretions, and a CT scan to examine urinary tract, or there could be a sonogram, also known as an ultrasound, to see visual image of prostate. Some treatments would be, or is definitely based on the underlying cause. So if it's caused by a bacteria, they would need to take an antibiotic. A patient could take alpha blockers. This will help relax the bladder neck and muscle fibers that connect the prostate to the bladder. NSAIDs can be taken for anti-inflammatory for comfort, and alternative medicine such as acupuncture, herbal remedies, and supplements. And if someone were to have prostatitis, a medical specialist that one could see is a urologist. Next, I'll be discussing carpal tunnel syndrome. Carpal tunnel is not built from word parts. A definition from our textbook is common nerve entrapment disorder of the wrist caused by compression of the median nerve. Symptoms include pain and paresthesia in portions of the hand and fingers. Anatomy that's affected by carpal tunnel syndrome. So the carpal tunnel is in the wrist. The carpal tunnel itself is made up of tendons, ligaments, and the wrist bones. The median nerve is affected that runs through the tunnel. This median nerve provides sensation to the thumb, the index finger, and the middle finger. So once the nerve is compressed, this is when symptoms occur. Some causes of carpal tunnel syndrome. Symptoms arise when there's a pressure on that median nerve. This pressure could occur when there's swelling, illnesses such as hypothyroidism, rheumatoid arthritis, diabetes, repetitive movements, and pregnancy. I personally work at Anchorage Fractional Orthopedic Clinic, and I work with a hand surgeon who does many carpal tunnels in a month for surgery. And so I'm pretty familiar with patients that have this disorder, and so what happens is mainly when they come to get seen, most patients complain of numbness in their thumb, their index finger, and their middle finger, that they can't hold a coffee cup, they can't, a lot of their things that they used to do in their life is writing has been affected, and it does really affect patients, and keeps them up at night. So it's been interesting to work in a clinic that deals with carpal tunnel syndrome regularly. Some pathology behind carpal tunnel syndrome is the compression of the median nerve is because of the hypertrophy and or edema of the flexor synovium. The pain is to be secondary nerve ischemia and not physical damage being done to the nerve. So when diagnosing carpal tunnel syndrome, a physician will conduct a physical exam testing feeling in fingers, and particularly I've seen the doctors look at the thumb, the index, and the middle, and they'll test the strength in the muscles of the hand. So x-rays may be ordered to look at bones in the wrist, and also electromyogram and nerve conduction study to see when a shock is sent down the carpal tunnel if it is slowed down. So when the shock is slowed down, that is what helps determine for a physician knowing that they do have carpal tunnel. So it's pretty interesting to see one of those tests being done and the needles and where they're placed in a patient. And most of the time patients say it is not fun to get that EMG done at all. Some treatments are, some conservative measures that can be done is bracing and hand therapy. More invasive would include a steroid injection into the carpal tunnel, and then your second choice is also surgery. There's two different types. You have endoscopic carpal tunnel surgery, and then you have open surgery, which they're different. The scars are different, and the incision in the hands and the devices that are used. The recovery time is much shorter in endoscopic carpal tunnel surgery, and most patients where I work, that is the option that my doctor that I work for, he conducts the open endoscopic carpal tunnel surgery. Some medical specialists would be a neurologist, a hand surgeon, an occupational therapist. And the doctor that I work for, after carpal tunnel syndrome, patients normally see a hand therapist 3 to 5 days after surgery. Next, I'll be talking about meningitis. Meningitis is the inflammation of the meninges. There's a word root, and a suffix. Definition: meningitis is an inflammation of the membranes, also known as the meninges, that are surrounding your brain and spinal cord. The swelling from meningitis typically triggers symptoms such as a headache, a fever, and a stiff neck. Anatomy affected by meningitis is the protective membranes that surround the brain and spinal cord. These membrane layers are dura mater, arachnoid, and pia mater. So causes of meningitis, there's different underlying problems that can cause meningitis. Some are viral infections, which are the most common, then bacterial infections, and the least common is fungus infection. But out of those, the bacterial infection that causes meningitis is life-threatening and needs to be treated right away. Pathology of meningitis: in order for there to be inflammation of the meninges, bacteria has to enter the bloodstream and pass through the blood barrier. According to bacterial meningitis, the blood-brain barrier mainly consists of tight junctions, which seals the endothelial cells that line the brain capillaries. Astrocytes, a type of neuroglia from the brain, closely attached to the endothelial cells and release chemicals to regulate the permeabilities of the tight junctions. The major sites of the blood-brain barrier are the arachnoid membrane, choroid plexus epithelium, and the cerebral microvascular endothelium. Once the bacteria breaks through the blood barrier, infection will occur in the cerebral spinal fluid. Diagnosing meningitis: it may be diagnosed by a family doctor by a physical exam and diagnostic testing. A doctor may look at a patient's head, ears, throat, spine, and skin. The diagnostic tests may be blood cultures to see if any microorganisms grow, imaging such as a CT or MRI of the head to see inflammation. Also, x-rays and CT scans of chest and sinus may show infection in certain areas that signify meningitis. A spinal tap to collect cerebral spinal fluid. If a patient has meningitis, the patient will have a high level of glucose, increase of white blood cells, and increased proteins. Treatment depends on cause of meningitis. For bacterial treatment, it consists of antibiotics and steroids to reduce swelling in brain. For viral, the patient will need to have bed rest, fluids, and medication to reduce fevers. For fungal, a combination of antibiotics will help resolve side effects. A medical specialty that will help diagnose meningitis and treat will be a neurologist. Next, I'll be talking about hypercalcemia. Hypercalcemia is made up of a prefix, word root, and suffix, and it means excessive calcium in the blood. A definition: hypercalcemia is a condition in which the calcium level in your blood is above normal. Too much calcium in your blood can weaken your bones, create kidney stones, and interfere with the way your heart and brain work. Anatomy affected by hypercalcemia. It primarily affects the central nervous system, the kidneys, and the large amounts of calcium is from an overreactive parathyroid gland. Some symptoms of hypercalcemia is thirst, frequent urination, nausea, vomiting, constipation, muscle weakness, fatigue, and confusion. Pathology of hypercalcemia. Calcium in the body is controlled by three major hormones known as parathyroid hormones, dihydroxyvitamin D, and calcitonin. These hormones act on bone, kidney, and the small intestine. The calcium enters the body through the small intestine, excreted by the kidneys, and stored in bones. To allow hypercalcemia to occur, the calcium regulation system is overwhelmed by an ambiguous amount of parathyroid hormone, cholesteryl, and a serum factor. Diagnosing hypercalcemia. Hypercalcemia may have few symptoms or none at all. To determine hypercalcemia, routine blood tests would be done to show the high levels of calcium in blood. A blood test will also reveal if the parathyroid hormone level is high. A doctor may ask for imaging of bones and lungs to see if there's an underlying issue like cancer that is causing hypercalcemia. Treatment options for hypercalcemia. Doctors may prescribe drugs that mimic calcium circulating in blood, bisphosphonates to help rebuild bone, prednisone if caused by high levels of vitamin D, and a procedure to remove malfunctioning tissues in parathyroid gland can be conducted. Medical specialists that are involved with hypercalcemia may be a family doctor, internal medicine, and blood health specialist. These are my references, and thank you so much.